requires that these are fully insured products, refer to insurance products where you pay a premium and the insurance company is responsible for the claims. Some big companies are self-insured, and that's a different animal. But fully insured products, by the Act, are required to spend 85% of their premium dollars on medical services. If it's small group, 80%. So, that's a huge change. That's a huge change. That means that insurance company profits are controlled. And they've had to give rebates if they didn't meet those targets. And it's much more complicated than that. It is a double-edged sword, because I can tell you from my years on the insurance side of the business, we were very focused on reducing the 85%, not the 15. I mean, also the 15, but the big return was on the 85%. So that's just the double-edged sword aspect of this, plus the fact that the bigger the number, the higher the 15% is. But everyone should know that this Act controls insurance company profits. I'm not going into this in detail. I'm assuming many of you are aware that if you file an income tax return that's $200,000 for an individual or $250,000 for a couple, that this year your taxes are going up to help support the Affordable Care Act. Okay? A payroll tax and a tax on unearned income. So, we're up to the big year, 2014. And let's make sure everyone is on the same page about individual insurance, because many people on group coverage have never even dealt with the individual insurance marketplace. That's where you apply as an individual. Today, in 45 of our 50 states, today meaning still 2013, you fill out a health questionnaire when you apply for insurance. And if you've never seen one, it's pretty similar to what you fill out when you go to a doctor's office. And the goal is to be able to truthfully say, no, I've never had this, I've never been treated for this, I don't have this, and to have very few drugs. So that's what it means to say individual insurance is medically underwritten. The person applying for it fills out an application, and the insurer has the discretion to deny. That's still where we are today, although the insurance companies are getting ready for 2014 when that goes away. There aren't these health questionnaires, excuse me, that determine whether or not you get the coverage. So they're publicly saying, we're going to entertain more applications from people with the kinds of conditions we wouldn't have entertained in the past. So that's a good thing. But they still have the right to refuse you. And if you're refused in Connecticut, you still have some other alternatives. Of course, I don't know if it's been mentioned already. Yes?
You're saying that even though you're not medically underwritten, they can still